We are back with Dr. Ali Hassoun, infectious disease specialist at Huntsville Hospital.
Dr. Hassoun, the CEO of Moderna, has said that the company won't have enough data to file for emergency use authorization for its vaccine until November 25th. If this does happen, how big a step is it in the search for a vaccine?
So I think it's an important thing to know the stages and where they get to. But it's been expected, and we've thought we really are not going to have the vaccine probably till the end of the December or early next year. So I'm not surprised they talked about that. I can tell you Moderna recently published in New England Journal their phase 1, phase 2 kind of study talking about elderly. And it seemed the elderly, even though they're a small number, have responded to the vaccine. So there's some encouraging data, but we need phase 3 data with full information about efficacy and safety, so we'll be ready to get it if possible. But it is expected probably end of December or early in the year, next year.
As it stands tonight, there are 9 coronavirus vaccines and late-stage clinical trials around the world, including Moderna, AstraZeneca, and Pfizer are the 3 in the U.S. So based on your knowledge and expertise, if you had to place a bet, which company do you think will have one first?
And that's very difficult to assess and know, because it's been very, in a way, what I call no clear enough data to know which one. I think enrollment-wise, it seems the one in Oxford has been ongoing and they've enrolled significant numbers. Pfizer as well. But I can tell you it's really going to be tough to know exactly which one is going to get to be the first. I think what's most important, whatever vaccine comes in, we need to know it's safe and efficacious.
Mm-hmm. There's an antibody cocktail, as they're calling it, developed by biotech company Regeneron, showing some promising results. Seems to reduce levels of virus and improve symptoms in some patients. Can you explain the difference between a vaccine and a treatment, and how important it is to have a treatment until we find a vaccine?
And that's a great question, because the vaccine benefit is we basically expose the patient to part of the virus, we call it killed virus, where it can initiate our body in a way that can start to fight the virus if it gets exposed to. So we produce what we call different proteins and immunoglobulins that the moment we get exposed to the virus, we can fight it off. In compared to the treatment, no. The treatment is really mainly if those who's infected with the virus, where if I got infected and have active viral shedding, I would use different type of treatment, which we call antivirus treatment like remdesivir. But this antibody through Regeneron, the idea of it is if I have the virus shedding, they have what they made an antibody, like a protein, go and attach the virus and prevent it from further shedding and causing problem. So the vaccine is mainly for prevention. The treatment is basically fighting that specific infection at the time if you had the infection. It is encouraging, actually, these data, but it's very early to know it's safe and efficacious, because they had very small number. I know multiple companies actually trying to do that, and it's encouraging because it's similar to what the convalescent plasma can do, but it's more specific. So it will be interesting if we can get that. It will be very encouraging to have it.
Let's talk about the future. Obviously, no one knows what is going to happen for certain, but do you expect another spike during flu season like other experts are predicting?
Yeah, so I can tell you my hope to avoid the spike and the surge is people thinking and following the guidelines, because I guarantee for them, if they go with the masking, physical distancing, staying at home if they're sick, and seeking attention, medical attention quickly, hand hygiene, we're really going to be able to cut down not just on the COVID, but all the other viral respiratory infection, including the flu. But if we don't do that, we're going to be in trouble. We're going to see significant issues, whether the COVID or flu or other viral infection. And it's going to be chaotic, because You cannot differentiate between these ones, and it will be really tough for the healthcare professionals, hospitals, and even the community. So I hope the people follow the basic prevention, and we're going to be good if we do that.
So you want to reiterate that for the community, your final message here? And I'm sure it includes all those things.
Yes, it's really essential for us, folks, whoever, whether community, schools, you know, a sport team, we need to follow these simple guidelines. And believe me, as we do it, especially the fall and winter coming, you know, the weather is changing, so people are going to be more in closed doors. They're going to be more exposed. Please keep physical distancing, reduce the number of exposures, do the masking, hand hygiene. Remember, you're going to benefit not just you, not just your family, it's the community, but also everybody else as well. So please follow these guidelines.
Dr. Ali Hassoun, infectious disease specialist at Huntsville Hospital.
Dr. Hassoun, thank you so much for your time and insight as always and tonight.
Thank you so much.